Dizziness or lightheadedness refers to a feeling of unsteadiness, faintness, or the sensation that you might pass out. It is a common symptom with a variety of potential causes. While often not serious, dizziness can sometimes indicate an underlying health condition. Types of dizziness: lightheadedness, the feeling of faintness or near fainting. It usually improves when lying down and may be accompanied by sweating, nausea, or blurred vision. Vertigo, a spinning sensation, as if you or your surroundings are moving, even when you're stationary. This is usually linked to inner ear issues. Disequilibrium, feeling off balance or unsteady when walking, often associated with problems in the inner ear or neurological disorders. Common symptoms of dizziness: faintness or a feeling of impending loss of consciousness, unsteadiness or loss of balance, nausea or vomiting, weakness, blurred vision, sensation of the room spinning. Vertigo. Causes of dizziness: the causes of dizziness can range from benign to more serious medical conditions. Below are some common causes. 1. Inner ear problems. Benign paroxysmal positional vertigo (BPPV) caused by changes in the position of your head. BPPV is one of the most common causes of vertigo. It occurs when small crystals in the inner ear become dislodged and affect balance. Vestibular neuritis or labyrinthitis, inflammation of the inner ear, often due to viral infections, can cause vertigo and balance problems. Meniere's disease, the disorder of the inner ear causing episodes of vertigo, hearing loss, and tinnitus, ringing in the ears. 2. Circulatory problems. Low blood pressure, hypertension. A sudden drop in blood pressure, especially when standing up. Orthostatic hypotension can cause lightheadedness. Dehydration, insufficient fluid intake or excessive fluid loss from vomiting, diarrhea, or sweating can lead to dizziness. Heart conditions. Conditions like arrhythmia, irregular heartbeats, heart failure, or poor circulation can cause dizziness by limiting the brain's oxygen supply. 3. Neurological conditions. Migraine. Dizziness or vertigo can be a symptom of migraines, even without a headache. Stroke or transient ischemic attack. A sudden loss of blood flow to the brain can cause dizziness, especially when accompanied by other symptoms like numbness, slurred speech, or weakness. Multiple sclerosis (MS). Some people with MS experience dizziness or vertigo due to nerve damage. 4. Medication side effects. Dizziness is a common side effect of medications such as antihypertensives used for high blood pressure, antidepressants, sedatives, and some antibiotics. Overmedication, especially with blood pressure or heart medications, overmedication can lead to dizziness. 5. Blood sugar and metabolic issues. Low blood sugar, hypoglycemia, common in people with diabetes. Low blood sugar levels can cause dizziness, sweating, confusion, and weakness. Anemia, the lack of red blood cells to carry oxygen, can result in dizziness and fatigue. 6. Anxiety and panic disorders. Anxiety attacks, stress, anxiety, and panic attacks can lead to dizziness or lightheadedness due to rapid breathing, hyperventilation, and adrenaline release. Phobias. Certain fears, such as fear of heights or enclosed spaces, can trigger dizziness. 7. Infections. Viral infections, respiratory infections, such as the flu or common cold, can cause dizziness by affecting the inner ear or through dehydration. Sepsis or severe infections. In rare cases, a severe infection can lead to dizziness due to systemic inflammation and decreased blood pressure. 8. Hormonal changes. Pregnancy. Hormonal changes, particularly in the first trimester, can cause dizziness and fainting. Menopause. Hormonal fluctuations can also lead to dizziness in some women. 9. Other causes. Dehydration. Lack of adequate hydration can lead to dizziness, especially after exercise or in hot weather. Alcohol or drug use. Excessive consumption of alcohol or certain drugs can affect balance and cause dizziness. Diagnosis of dizziness. To determine the cause of dizziness, a healthcare provider may perform medical history. The doctor will ask about the onset, duration, and nature of dizziness, as well as any accompanying symptoms. Physical examination, blood pressure, heart rate, and a neurological examination are often part of the evaluation. Balance tests. These tests may include the Dix-Hallpike maneuver, which checks for positional vertigo. Blood tests, to check for anemia, infections, or metabolic issues like blood sugar problems. Imaging tests. CT scans or MRIs may be performed if a brain condition, stroke, or tumor is suspected. Hearing and vision tests, in cases where ear or eye problems may be contributing. Treatment depends on the underlying cause of dizziness. Some common treatment approaches include 1. Inner ear problems. Canalith repositioning maneuvers. Specific head and body movements like the Eckley maneuver can help move displaced crystals in the inner ear back to their proper location, relieving vertigo in conditions like BPPV. Vestibular rehabilitation. Physical therapy designed to improve balance and treat inner ear problems. 2. Circulatory and heart issues. Blood pressure medications. Adjusting medications for low or high blood pressure can relieve symptoms. Hydration. Increasing fluid intake and correcting electrolyte imbalances. Compression stockings. For people with orthostatic hypotension, these can help improve circulation. 3. Medications. Antihistamines and antiemetics. Drugs like meclizine or dimenhydrinate can reduce dizziness and nausea caused by inner ear problems. Migraine medications. For those with migraine-related dizziness, prescription drugs can help manage the condition. Anxiety medications. For dizziness linked to anxiety or panic attacks, anti-anxiety medications or therapy may be beneficial. 4. Lifestyle adjustments. Increase salt intake. For people with low blood pressure, a small increase in salt intake can help maintain blood pressure levels. Change in posture. Avoiding sudden movements and getting up slowly from a seated or lying position can prevent dizziness. Exercise. Regular physical activity can improve circulation and balance. When to seek medical attention. While dizziness is often harmless, seek medical care if you experience sudden and severe dizziness, chest pain or shortness of breath, fainting, severe headache, blurred vision or slurred speech, numbness or weakness in the face or limbs, as these could indicate a stroke. Conclusion. Dizziness lightheadedness is a common symptom that can result from a variety of causes, ranging from dehydration and anxiety to more serious conditions like heart disease or stroke. Most cases of dizziness are not life-threatening, but persistent or severe symptoms should be evaluated by a healthcare provider to rule out serious underlying causes and ensure proper treatment.